Thank you for tuning in to NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined by Stella Whitney-West, CEO of NorthPoint Health and Wellness Center. Ms. Whitney-West has been at NorthPoint since 2004 and has been our CEO since 2007. And even before coming to NorthPoint, she had a long history of serving the North Minneapolis community. Her extensive experience in government and policy has been honored with several leadership positions and fellowship awards, the most recent one being the 2021 Minneapolis-St. Paul Business Journal Women in Business Award. She has been a leader in the community in several capacities, most recently as a member of the Minneapolis Inclusive Economic Recovery Work Group, and we're thrilled to have her join us for a conversation today.
Hello. Thank you, Biftu.
Thank you for joining us, Stella. I'm so thrilled to have you here for our inaugural episode of this show. And we have some questions that we would love to ask you and just pick your brain and have a great discussion. So we'll dive right in. So how would you describe NorthPoint's role in the community?
Oh my goodness. Well, NorthPoint is what I'd like to refer to as a historical institution, and that we are a community institution that has been in North Minneapolis. This is our 54th year now, and we are one of those institutions that really came up through the community. When North Point, and previous to that, we were called Pilot City, and a lot of people still refer to us as Pilot City. And I endorse that because that is part of our history, and we have generations of families that are being treated at North Point through our health clinic and receiving services, serving on our board. But as a community legacy institution, it was the community that came forward and developed the plan and actually made a demand that an institution like North Point. So some people remember that there was on Plymouth Avenue, where we are located now, Penn and Plymouth, there was a rebellion in 1967 in the summer. And people were just at a breaking point, much like what happened with the murder of George Floyd. And it just was a point where people felt like enough was enough. And so out of that rebellion, the community came together along with uh, the city of Minneapolis, Hennepin County, other neighborhood groups, and put pen to paper and came up with the vision for Pilot City at the time, but a institution where community could be present and it was governed by the community, but that it was a one-stop shop. And so we are really proud of that history.
Thank you. It's always great to know the origins of a community organization like NorthPoint. My next question is about those who aren't familiar with NorthPoint. What would you want them to know, people who aren't familiar with our work?
Well, what I would want them to know is that we are, as I mentioned before, a community governed institution, and a lot of times people say that as almost like it's a tagline, but for us, it is really how we are governed, and it is actually a requirement for community health centers like NorthPoint. So we are considered a federally qualified health center, and
Mhm.
it's required that at least 51% of our board members have to be actual patients of our health center.
Right.
And it is that board that I, as the CEO, report to.
Mhm.
And the board makes major decisions about our budget, the different services that we provide, as they would with any other governing board. But what I think makes having a community board very unique, when it's the same community that you are serving. Um, the whole idea of being able to have engagement of the community is kind of built into our DNA. We don't have to go out and necessarily um, do something extraordinary because the community is within our four walls. The community is part of us. The community governs us. And I think that's what makes us unique, as compared to other organizations. And the fact that we still have a long history, not only of serving North Minneapolis, but also producing, in terms of healthcare, some of the, I would say, the smartest healthcare providers. Many folks that got their start at North Point Pilot City. And so we're able to point to that, to be able to say that within our school based clinics, because we do a lot of work with the schools, that we have generations of children who started with North Point and now are adults in the community. And so that I think is special as well.
That's great. Thank you. So, turning to our patients and our community, how do you think North Point responds to the needs of the community, of our patients?
Well, I think that, and I would hope that the community believes the same way, is that we respond in real time to the needs of our patients, and also I would say to community participants or residents that use our other services. So in addition to healthcare, because we have medical, we have dental, behavioral health, we have a on-site pharmacy, laboratory services, but we also have services, social services. We have a food shelf. We have programs that provide support for housing. We also have staff that work with families, that work with juveniles who are involved in the correctional system, to help them navigate that system, and more importantly, to help them in their growth as young men and young women, and to know that. Just because there was a mistake and that you're involved in the juvenile justice system, that doesn't have to define you. And we have
Mhm.
staff that are to work with those folks. Um, so I think that we then are able to listen and make adjustments. And again, because of the unique role that our community board plays, we can quickly make adjustments in our programming. We also are constantly, and thanks to your department, Biftu, we're always looking for ways of getting feedback, either through our website, our newsletters, programming like this, but always looking to hear from the community as to um, what their major issues are, what needs they have. the environment that we are in right now with COVID. North
Mhm.
Point was one of the first that we stepped up back in 2020 with doing major testing for COVID. In fact, we turned our ramp into a drive through testing site
Mhm.
because people were needed to know if they in fact were infected with COVID. And this was prior to the vaccines. And then when the vaccines became available, we first started making sure that our staff was vaccinated because we are front line, and then making sure that we had vaccines available for the community and have continued. And we are now vaccinated well over 23,000 folks. And when the vaccine was expanded to children, to younger folks,
Mhm.
we were really out there, and we were really excited to see families. Actually, our vaccine clinics, might as well call them family vaccine clinics, because
Mhm.
the whole family shows up. And
Right.
that was our way of adjusting to this public health pandemic in a way, and making sure that it was available to the community, in the community, and by North Point, which is considered a trusted partner in the community.
So, as CEO, can you tell us about your strategic priorities and how you're looking into the future for North Point?
Well, one of my largest um, priorities we see happening right now. So anyone who hasn't driven by the intersection of Penn and Plymouth, we encourage you to come by and see.
Mhm.
We have broken ground on our new campus expansion, something that we have been working on um, for over 10 years.
Mhm.
We have grown to the point where we were bursting at the seams. We have a what we call a integrated model of care, and that is that we
Mhm.
treat people and families as the whole person, as the whole family.
Mhm.
We talk about one door, so that it doesn't matter how you access North Point. We're going to provide a comprehensive support for you. So, whether you come in through our school based clinic, or you come in through the food shelf, or you come in through medical or dental, we are going to make sure that we see you as a whole person, connected to a
Mhm.
family, connected to a community. And we ask those kinds of questions. Are there housing needs? How are you feeling? And making sure that sometimes symptoms are actually an expression of other root causes. So someone can
Mhm.
come in, and we've had this where they have physical symptoms.
Mhm.
Um, and then through asking questions and building a relationship, you find out that people are struggling, that they are
Mhm.
stressed out because of their housing situation, or that they're
Mhm.
homeless, or that they don't have enough food in the house. And so rather than having to send them to another organization, we have a food shop. We're
Mhm.
able to make sure that before you leave that appointment, that you have food, or that you're connected with someone that can help you with housing. So that is part of it. But also, let me go back to our expansion. So, because
Mhm.
of the way that we deliver services, we needed to have a physical structure that allowed us to do that, where we
Mhm.
could have on one campus those services, and where, as we have grown in the number of families that we are serving, we needed to have space for that. The other, I think, important part of having this major expansion is that it is a major asset to the community. So we also are a trainer of healthcare providers, social service providers, and so people can come here and do their internships in their own community, serving people that look like them. And
Mhm.
oftentimes, many of the students who come here stay and have their
Mhm.
careers here. So having a state of the art institution uh,
Mhm.
to be able to do that again is a major, major asset for North Minneapolis. So when we talk about um, what is, and I would say one of our major strategies, it was to be able to bring this and along with that, additional development that has occurred because of the expansion of North Point. The
Mhm.
building at 1256, having that building and the ramp has allowed us again to have the large scale COVID testing, vaccination clinics, to be able to have a state of the art conference center. Right now, we're using it for our vaccine clinic, but soon
Right.
it will be back to a conference center. And that was um, one of the things that we wanted to make sure that, again, people didn't have to leave their community in order to
Mhm.
have access to um, information or to have major speakers come in or to have major conferences, that we could have it in our community. So that was something that we wanted to make sure that was available.
That's wonderful, and it's very exciting. This campus expansion is so many opportunities that can come out of it, and it'll be a really great addition to the community. Very exciting. So we're airing this in February for Black History Month, and we just want to know, what does Black history mean to you?
Well, Black history is me personally as a Black African American woman is my history, my family's history.
Mhm.
Um, I came up through the school system, public school system, and
Mhm.
we did not get a formal education around the contributions of African Americans,
Right.
not only to this country, but to the globe, to the world.
Mhm.
And oftentimes it, was a paragraph or two, and it may mention slavery, but it never really talked about it in detail and talk about even the accomplishments of Black people and
Mhm.
the accomplishments going all the way back to Africa, and
Mhm.
that as a people that we have made major major contributions in science, in art, and in culture, and that we have a rich culture. So that's what Black history means, and that is an opportunity to showcase and show that to the rest of the world and to the community. And then I also think that, particularly now, this is a very trying time
Mhm.
because it's like we are being challenged about inequities and racism, uh,
Mhm.
which has never gone away. We need to be clear
Right.
about that. It has never gone away.
Mhm.
Now it is very much like we experienced in the 60s. It is now open and on display, right? And particularly um, in Minneapolis, the murder on display in full daylight. of George Floyd by a police officer put us on the map uh, in the world.
Hmm.
Yet, um, Black people, it was not news for us because we
Right.
knew that many of us and many of our um, brothers suffered at the hands
Hmm.
of police, and
Hmm.
that there was definitely something that needed to be done, right?
Hmm.
So I think of Black history as that opportunity
Hmm.
have that spotlight and share the not only the struggle, but more importantly, in spite of the struggle, the major contributions of Black people to the world.
So we talk a lot about health equity, and I just want to know sort of your thoughts on race and health equity, and then other identities, including gender. How do you see those play out?
Well, I think that the thing about health equity is that it's all connected, and we talk
Mhm.
about in our space the social determinants of health.
Right.
And oftentimes people want to segment, that this part or this part. No. So your overall health and well-being is also connected um, to your housing situation. It's connected to your neighborhood. It's connected to your ability to provide economically for your family. All of that is connected. Your mental and emotional health, which we don't talk enough about, that we don't create enough safe space for people to understand that that is just as and oftentimes even more important than your physical health, right? And
Mhm.
too many times we have put a stigma around mental health, right?
Right.
And I think particularly for Black people and BIPOC communities,
Mhm.
because of the conditions and impact of racism, we live with a lot of stress. And
Right.
oftentimes we don't even recognize how that stress impacts us physically,
Mhm.
emotionally, and mentally.
Mhm.
And it creates, when people are looking at data, it creates the statistics where, like, for example, around maternal child health,
Mhm.
where there are Black women who have poor maternal health or birth outcomes, and it's not connected to any social economic um, uh, factors,
Mhm.
but connected to the fact that as a Black woman, and as a Black woman trying to navigate through the healthcare system, they have had some experiences that translate to having poor health outcomes and poor birth outcomes for their children. That is
Right.
a inequity that we definitely have to address, and we
Mhm.
have to address it from the root cause around
Mhm.
racism. Right? It can't
Right.
just be, oh well, maybe they need to go to a better clinic.
Mhm.
It's like, okay, let's talk about the root cause. So when we talk about
Mhm.
health equity, we also have to look at those root causes and understand is complex, but also understand that it's one that we have to solve and that we have to be courageous enough to call
Mhm.
it out and
Right.
understand that impact that it has on us, not only as a community, but also this entire country, right? There's an
Mhm.
impact because
Mhm.
if a major segment of the community is not doing well,
Mhm.
we're not doing well. So
Right. Absolutely. Thank you. And thank you for that reminder about root causes and um, social determinants of health. I think that's a huge part of the conversation around health equity.
it is.
Um, yeah. Thank you so much for your time. Um,
Oh, we're done.
yeah, we are. Those are all my questions for you. And this has been a really wonderful conversation. I hope more people get to know more about the leadership here at NorthPoint and what we're doing in the future. It's all very, very exciting. So thank you, Stella Whitney-West, CEO of NorthPoint Health and Wellness Center.
And thank you, Biff, too.
Thank you for listening to NorthPoint Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know the times get hard, and we're here to help at North Point. When you're feeling low.
So going deeper into your identity as a Black woman and African American woman, um, being in North Minneapolis and being a leader, what does it mean to you to be in such a powerful leadership role?
Well, I think the most important thing for me is that um, other Black girls, other Black women um, can see and hopefully see that they too can
Mhm.
be a CEO of a major institution.
Mhm.
Um, that they too um, can really, and this wasn't necessarily a job that I put down on my, top 10 list. I did
Mhm.
not. But it was one that I am most grateful for because it is one that it seems like I was in training for and has given me the greatest amount of satisfaction. And I feel um, most of the time, almost all the time, it's not like a job. It is like a calling. It's like who I am,
Mhm.
and I feel fulfilled by it. So, being a Black woman, I want to be able to, at the same time, uh, be an encouragement to other
Mhm.
Black women that that they can um, even be in a position like mine, or even strive higher. But whatever their goals are or their dreams are, that they can do it, that they can be it, and that there is support. I think that um, we as of African American people, as Black people, and as women, um, I think we have a responsibility to support other women and
Mhm.
Black people,
Mhm.
particularly when you are in leadership positions.
Mhm.
Sometimes it can be a position where you feel alone. And I have learned through my career, I call it a kitchen cabinet, where
Mhm.
a group of people that don't see you as the boss, but see you and know me as Stella. And some of my kitchen cabinet folks have known me from the days when we were running around in the Rondo neighborhood.
Mhm.
And those are the folks that can, as they say, pull your coattail
Mhm.
sometimes and tell you the truth, and you know it's the truth.
Right.
Or the folks that when you really want to let off steam,
Mm.
and you can do that, and they're not going to, and you don't worry because these are folks that know you and care about you. So it's so important to, I think, leaders make sure that you have that kitchen cabinet, those folks that you can call when you need to just, hey, I got to vent, I got to scream,
Mm.
I got to holler, I got to tell you that this is what happened. And
Right.
when it's all done, you're like, whew, okay.
Very, very true. We all need those people in our circles.